into your pediatric care module. So we are now in your Pediatric 1. So Pediatric 1 deals with the very basic description when it comes to your caregiving, why children needs caregiving, why family needs to hire a caregiver. So, and plus also we're going to deal with the reproductive system, and we have also your what they call this one, your contraceptive methods, and we have also your pregnancy, to the extent we're going to deal with deliveries with this pediatric care. And the last topic could be your handling infants, and your bathing, dressing, changing diaper, feeding, burping, and all. So we're going to have that one in this module. So this morning we have discussed the first part. So I'm going to read na lang this one so that everybody could understand and everybody could also react according to what I have discussed this morning or this afternoon, diba? Because we have two batches. So these are afternoon and this morning. Just like all other modules, again, we're going to provide a grade with this one for your skills, which is 50%, and you have your quizzes and exam which is also 50%. So we're going to discuss now caregivers' role in the care of children. So I have discussed this one this morning, but since I'm doing this video, we have to repeat everything. So caring in the role of caregiver. So caring or reverence for life is an essential ingredient in the role of a caregiver. So if you have any questions, you may ask me personally there in school. So caring acts and decisions are strong elements of the caring processes carried out by the caregivers. Caring is the way of relating to others that develop in the depth through reciprocal trust and honesty. Actually, if we will become a caregiver to a home, of course, we will be dealing with people also, just like the mother, the father of the child that we're going to take care. So definitely, we have to what we call focus on our goal of what do you mean of our goal to care for that particular child, diba? Focus on our goal to be in charge or to assist the mother, either be in charge or assist the mother in the caring of that particular child of her. Caring is the way of relating to others that develop in the depth through reciprocal trust and honesty. Siyempre, we are the intruder in the home, so we have to adjust also with the different policies to be implemented by the mother, that is being implemented by the mother, and we have to follow all those things that the mother will going to ask us to do, especially if it is for the better of the child. Okay, so caring can become a way of life in which commitment results in the caregivers using themselves as therapeutic agents. So what do you mean by therapeutic agents? That is offering self. Okay, offering self. What do you mean by offering self? You may just be there to listen to the child or listen to the mother in case she wanted to talk about anything, especially if it pertains to the welfare of the child. In this situation, caregivers, as part of the medical profession, are willing to take risks and assume responsibility for their outcomes. So commitment leads to a caregiver to enter situations with parents or children that they cannot face alone. In the caregiver-parent child relationship, health maintenance is the number one priority. So you have to remember this, the health maintenance is the number one priority. The caregiver should focus on the word caring and not to confuse it with curing. Caring, helping is an act of helping, guiding, and for some, counseling. Curing is not the responsibility of the caregiver, and it occurs when the client is ill. Also, di ba, kung pag curing lang pag ill and sick ang client. But the caring, it is a continuous process in both wellness and illness, which needs a caregiver's participation as a member of the health team. So you have to remember that also. So we have here letter B, family, letter B, the topic letter B, we have family and child-centered care. So remember, when you're going to become a caregiver, you make sure that you're not going to limit alone to the care of the child, but the family as a whole, as a whole. Another, we have to, especially when dealing with the child and the mother, we have to be responsible enough to be in the middle always, in the middle between the mother and the child. We should not take sides. We have to be there to represent the mother, to represent the mother to the child, and of course, to represent the child to the mother. Okay. This type of care calls for flexibility and creativity in the health team as it plans intervention in terms of the needs of parents and child of their coping resources. Although the family is the ultimate coordinator of its own care, the caregiver can help establish a positive environment for family members and through the therapeutic use of self. What do you remember therapeutic use of self? You have to offer yourself to represent the mother to the child or the child to the mother. So help to accept and utilize your care. So child's right to health care. Human rights which are essential to total personal development belongs to everyone, including your children and adults, men and women, well and ill persons and individuals of all races. Children have response the right to know specific to knowledge of their state of health or illness, decision regarding treatment, and important ensure the information is free flowing between parent and their children, health providers, and among parents, children, and health providers. So remember that the child has the right to know about, especially when it is about with her own system. So we have now your caregiver's role in the care of children. Again, we have letter D topic, areas of care. As you can see, physiologic need is the place at the very bottom because it is the number one priority. And next to that is your safety needs, and the third is need for love and belongingness. The last one there is your aesthetic, which given the least priority or the least importance. It is still important, but of the least important compared to those physiologic, safety, need for love and affection, need for belongingness, need for creativity, and cognitive needs for knowledge and comprehension. That is according to Maslow, So basic human needs. One, we have physiologic needs for survival and stimulation. So this includes your water, air, food, warmth, elimination. So you have understood already the water, air, food, warmth, diba? So another elimination. So elimination, the need to urinate, the need to defecate. So wala yung makagawa sa hospital. Wala pwedeng lumabas sa hospital kung hindi pa siya nakain, hindi pa siya nakatae, So, bakit? Kailangan nating i-monitor kung naka-eliminate na yung individual before she will be asked to leave the hospital. And then we have sexual activity. So, no man or nobody could live without sexual activities, except for those who are called to be on that particular vocation, such as your nuns and your priest. Okay, but other than that, everybody desire to have sex. Remember that. So not only women and not only men that has problems with sex. Either both. We have men or women, but it's up for the individual to adjust as to and to take measures as to what to do about this problem. And then next is avoidance of pain. So everybody has this need to avoid pain. Okay, we have to avoid pain. Why? But why? Because of course, a person avoid pain, especially if he or she did not experience one. But if he does experience one, the person could be able to manage pain, diba? The pain tolerance will going to increase, although and then that time the pain will become manageable to one. And need for love and safety and security. Need safety, protection, and security. This is also the reason why we need to grill our house. We need to put fences, high fences, and of course, we need to close our doors and windows, and even we need to have a dog in our house to secure ourselves from those people who are going to do bad things on us. So that is for need for safety and protection. Another thing is, for your safety, you have to wear mask, diba? We are wearing mask, that is also for to ensure safety. And you need for love and belongingness, affection, closeness, and intimacy. So at the age of 30, pag wala ka pang girlfriend or wala ka pang boyfriend, just go, you will be having a hard time to find one. So ang tendency, we're going to resort to other nationalities, di ba? Because of that problem. So, that is the need. Remember, number 3 po siya. And that is the case also why those people who has this, who belong to a broken family, find their own families through marrying at the young age, di ba? That is a problem. And need for recognition and esteem. So this is the need to be recognized and being accepted. So recognize and esteem from others and value respect to oneself. So how would you do that? How is it being manifested? For example, the person we're going to ask somebody to recognize the effort. At least clap your hands or at least give some pat on the back, especially if you're tired doing something for a day, di ba? So you have to you have to, what we call this one, at least feel good of yourself, di ba? For example, in husband and wife basis, when the husband arrived from work, and then tell the ang wife, wala doon, wala pang sinaing and all, how could be the husband be recognized? Felt that recognition, that hindi naman siya piniprepare ng pagkain ng asawa niya. So, no recognition at all. So, it will going to lower herself down. And then the respect of oneself would be down. Okay. Then needs for creativity and self-actualization, making ultimate use of individual abilities. So you need to be creative, di ba? How? So dapat you have to encourage a child when the child is drawing something, you have to encourage the child to draw more. Okay, to emphasize your need for creativity. Another, we have also cognitive needs for knowledge and comprehension. So it's the reason why you're here studying caregiver, because you wanted to gain knowledge about caregiving. So the last one is aesthetic needs, desire for beauty in its own various forms. So in this case, our desire for beauty could be seen in wearing some makeup, and then our desire for beauty could be very much seen, especially if you're going to be applauded by one because you look beautiful today and all. So those are the things that we're going to boost our esteem also, and our aesthetic needs will be met. Okay, will be met. Concepts related to childcare, we have health promotion and prevention of illness. So, dapat health promotion. So, tinuturo natin mag-hand washing, mask, and then gown. That is for health promotion. And prevention of illness, by doing so, you are prevented with your illness. And we have also health maintenance. So, that is to restore life and prevent from any complications. And next, last one is health restoration. In cases of there's a problem, so you have to restore your health. Family is an open system exchanging information, matter, and energy within itself and with its environment. Because of its nature and its dynamic interaction, the family can change. Definitely, family do change, di ba? Pwede siyang ma-minus, pwede rin ma-pass or mag-add. What children mean to their parents? Children are perceived as necessary to the happiness of the family. Children satisfy some of the parents' emotional, psychological, social, and even spiritual needs. Children enliven family life. While they are growing, they provide entertainment for the parents and satisfy some of their parents' needs for affection. Children may prevent loneliness and boredom in what may be called as your dreary life. Okay. So, dapat, We have kids because they give us hope, then they talk to us emotionally, we cried with them and all. So role of parents. Biologic mother is a woman who has conceived and given birth to a child who had the primary responsibility for socialization of the children or the child. She will perform the act of mothering. The mother was assumed to be the most important influence in the child's life. Okay. Biologic father we have is a man who experiences pregnancy with the women, including the physiological and psychosocial changes that occur traditionally in a two-parent family, and father's major responsibilities for his child after their birth consider as supporting them financially, occasional babysitting, rough and tumble play, giving the evening bath, and then looking at the school grade report and providing discipline. So that is what to expect with your father. So types of family, we have your nuclear family. Pag bago pa lang kayo, nag-asawa na, so that's your nuclear. Meron kayong anak, pero isa lang. Extended family, pag nakisama ka sa yung mga in-laws, di ba? That's extended. And then we have emerging family styles. New form of nuclear family in one home, ha? New form of nuclear family. So, bago lang kasal, wala pang anak. Single parents, may nanganak, pero walang asawa. And then communal living, and then together with your gay and lesbian household. So those are the things that is concerned with the types of family. Stressors affecting the family, we have chronic illness of parents, that is one. Substance abuse by children, of course. Parental divorce and parental death. Those are the things that you have to worry about. Good day, everyone. So we're going to continue our discussion with our Pedia 1 or Pediatric 1. Now we are at Reproductive System Review. So please refer this discussion to your handouts. First is, so basically we have the human anatomy in our, as one of our modules as a caregiver, in becoming a caregiver. But since we're going to deal with your pregnancy and all, so you have to study about your reproductive system. And since we're going to have the female reproductive system, we have to study still your male reproductive system. One is your testes. Your testes is regarded as your functional unit of the male reproductive system. Why? It is the one that it is where your sperm cells is being stored. And number 2, we have your scrotum. The scrotum is being encloses your testes, or the one that is protecting your testes from extreme environments. When you say extreme environment, so you have experienced cold, so cold environment, automatically the testes or your scrotum looks like as if it is crumpled paper. It will going to crumple, and of course it will going to draw itself to the near the body. So of course it will going to decrease its size since it will become crumpled. While during hot or pag mainit yung panahon or hot weather, it will going to distance itself from the heat produced by the body. That is why it will going to sag. So, kung sa Bisaya pa, malanday ang imong scrotum, or the sac that encloses your itlog, which is your testes. Number 3, we have the seminal vesicles. So these are 2 small glands that stores or produce majority of the fluid necessary in making up your semen or your semen or your sperm. And number 4, we have your penis. Your penis is as a muscular organ that is considered as the erectile organ in males comparable to your clitoris in your female. And of course, it will going to function for your sexual intercourse. And next is number 5 is your epididymis, which is regarded as transport and store the sperm produced by the testes and bringing each of the sperm to your maturity. While number 6, it is the vas deferens, which transport also mature. This time, not only the production of your sperm, but the vas deferens is it transport the mature sperm to the urethra in preparation for ejaculation. Okay. Well, the last one is your ejaculatory ducts, which delivers now your sperm to the urethra, adding it with what you called as your secretions plus your additives from the prostate necessary for sperm to function. Okay. So, yung ejaculatory ducts, ito po yung daanan ng sperm na nakastore sa epididymis and then na dumaan sa vas deferens para ma-ejaculate yun po. So, it will going to deliver the sperm to the urethra at adding it with what you called as your secretions or plus your fluids produced by your seminal vesicles from the prostate necessary for sperm to function. And then, so this is now your picture. So as you have seen here, your penis is here. So it is composed of your muscle, or as you can see, this portion here, the not colored ones. So it is now your muscles. And of course, this is your ductus deferens. Okay, this one. And your epididymis in crumpled section, plus your testis here, and of course your scrotum, and your prostate gland here. So, this portion here is your urinary bladder. So, your seminal vesicles, yung area po na nagpo-produce ng fluid, diba? Para in making up with your sperm. Okay, ito po siya. So, yung sperm niya po na nagaling sa what we called as your epididymis, where is that? Here, ay pupunta siya, magta-travel siya dito, at magmamature siya para ma-ejaculate. Okay. So here, you have, now we are at your female genitalia. Your female genitalia is divided into two. We have your internal sa loob, external sa labas. I've done this video already several times because I always forgot to click the button. So nice here. So we have your uterus here. This is your uterus. In your uterus, you have your 2 ovaries. You also have 2 fallopian tubes. So try to observe the pointer, ha? We have the ovaries here. And then we have the fallopian tube. And And of course, your uterus. And in your uterus here, this is the fundic height or the fundus. This one now parang mountain. It is the fundus. But it's labeled here as uterus because actually this entire part is the uterus. And of course, here we will say, this part here is your vaginal opening or orifice. So this is now your external part. Okay, dito nga ito sa ito sa pointer. Ito po yung external part ng what we call as your vaginal opening. And this now is the vaginal canal or the vaginal canal nga. But it is labeled here as your vagina. And we have the cervix here. Okay, so well labeled na po. Now, we're going to discuss now your fallopian tube. Actually, we have two. This is the fallopian tube. So this part here, parang kamay, ito yung fimbrate. And we have infundibulum here, ampulla here, where fertilization takes place. And the isthmus, this will be the one to be cut during BTL, or bilateral tubal ligation, the isthmus, and your interstitium. Okay. So again, interstitium, and then the isthmus, and the ampulla is the outer third part of the fallopian tube. Bakit po? We have one interstitium, two isthmus, and then the third your ampulla. Okay, now, we are going to proceed with the external female genitalia. So we have here the mons pubis or your buna-buna. And then we also have the prepuce, the one that protects your clitoris, which is the most erectile organ in female comparable to your pedis. And then we have your labia minora here, and that protects your urethral orifice or your urinary meatus here, and your labia majora here. And below your urinary meatus, you have your vaginal opening here. And of course, you have your anus in this part. And in between your anus and your vagina, this is now your perineal area or the perineum. This will be the one to be cut or cut mid-lateral during delivery here. Okay. And you have to support the perineal area, especially when the women were going to go with the delivery of the baby. Okay, so we'll proceed. Now, so before we're going to have the fertilization that we're talking about, so we have your ovulation. Ovulation is the release of matured ovum from the ovary. So as what I've said, so your ovary, we're going to release your ovum or ripened egg, and it will be captured by your fimbriates, and then it will be brought now to the body of the uterus. But before we're going to enter into the body of the uterus, it will going to enter first your ampulla, and when there is sexual intercourse in your ampulla now, there will be the union of your sperm and the egg cell. Oh, it will take place in the ampulla. And we have here your menstruation. Periodic discharges of blood that passes from the vagina. So, body structures involved, we have your hypothalamus. This is the brain. And then your anterior pituitary gland. Actually, the pituitary gland is divided into two. Anterior, which means the front. And then the posterior, which means the back. Your anterior pituitary gland is responsible for the hormones produced by your reproductive system, including ovulation and, of course, your menstruation. And, of course, we have your uterus and then the ovary. In your anterior pituitary gland, it will, as instructed by the hypothalamus, it will going to release FSH, or what we term as your follicle-stimulating hormone, to encourage now your FSH will now encourage now your ovary to release a follicle, or what we call as an egg. Okay, so stages of your menstruation or ovulation. We have pre-ovulation stage, that is before your menstrual flow, before your ovulation, and then post-ovulation stage, That is your 5 days after your ovulation. And of course, we have your menstrual stage. Okay. Now, let's say, you remember that if there is a sexual intercourse that occurs within that period wherein the woman is ovulating, the women were going to have menstrual flow because your menstruation is regarded as your frustrated ovum po siya. So, for example, wala po, nakash na po ni Fimbre yung egg, and then from the ovary, and it travels here to the outer third part of the ampulla, at meron po yung sexual intercourse, so may sperm na may sperm na mayroon ng enzyme ng hyaluronidase na nag-break sa protective coating of your egg, and then it results to fertilization. And of course, from fertilization, from there, the embryo will going to travel from your fallopian tube to the body of the uterus here for implantation. Okay. So that is your situation. How long does ovulation last? Remember, ovulation's always 14 days after your menstrual flow. So when you count 14 days, you have to count first the first day of menstruation. So that is your last menstrual period, which starts on the first day of menstruation. In here, as example, 1 to 5, nag-menstruate ka po. So 1 po siya. That is your, what we call as your, last menstrual period. And then from there, you're going to count from 5 days, 6, 7, 8, 9, 10. And we have these days, actually, 5 days after what we call your first day of menstruation, 7 days to 10 days. Okay, bakit? Mag-count ka 1, 2, 3, 4, 5, 6, 7. Dito, 7. So, pag dito, 7 days, pwede ka mag-sex dito. So, 5, 6, and 10. Actually, hindi po siya accurate, ha? Because the calendar method would be that effective if you have observed now your 1 year menstrual period. But if not, no. Okay, because it all usually do fail. And of course, from there, 9, 10, 8, 9, 10, 11, 12, 13, and then your 16 will be your ovulation, mag-release na po ng egg. So from here, and to there, no sex. The violet portion, no sex. Bakit? There's a tendency that you will become pregnant, ha? So, pwede ka mag-sex, dito lang po. So, based on the calendar method, you have to count 7 to 10 days after your ovulation. Excuse me. So, 7 to 10 days before na menstrual period. So, ito po, 1, 2, 3, 4, 5, 6, 7, 8, 9. Dito pa sa part na to, pwede pong mag-sexual intercourse. Okay. So, that's it. And the next topic, we have the details and terminologies. We have 12 to 24 hours, the lifespan of the ovum, 90 seconds, the sperm cells, which is the cervix, 5 minutes, sperm cells, which is the fallopian tube, 48 hours, that is the amount of sperm cells functional lifespan of your spermatozoa. While your 120 to 150 ml, millions pala, is the amount of sperm cells per ejaculation. Spermia with the prefix A added to the root word spermia, it will now make the word your absence of sperm cells. While oligo means scant or little, oligospermia means sperm cells less than 21 millions. Okay. So, again, when there is sexual intercourse, the 120 to 150 millions of sperm cells were going to rush inside your cervix within 90 seconds. And of course, to the fallopian tube, particularly at the outer third part, your ampulla, within 5 minutes. And those sperm cells containing your enzymes, hyaluronidase, will be the one to break the protective coating of your egg, termed as your zona pellucida and your corona radiata. Okay. And those are it. So, after that, may fertilization na po. Let's imagine wala akong fertilization. Bakit? May IUD. So, these are the methods of contraception. Number 1, intrauterine device is inserted in the vagina that fits the uterus to prevent pregnancy and by stopping the sperm from reaching the egg. So, as you have seen, ito po sa kamay, yun ang copper tip po ang sabi dito. And then, we have your tail here, the thread. Usually, plastic po yan. And then, ito po. So, it reaches now your fallopian tube. Okay, not to the uterus. To the body of the uterus, I mean. And it blocks with its tip. Here and here, it blocks now the entrance of your sperm to the outer third part of the fallopian tube, your ampulla. And thus preventing what we call pregnancy. Okay. Pero bawal po si IUD ha. This is only 93 to 95% effective. Bakit may hindi effective? Remember po, explorative ka or kung pa na-explore ka sa wife, so pwedeng kahit anong posisyon, kahit parang helicopter and all, of course it will be dislodged or hindi po siya ma-in place. So, dapat always in place siya. Pero during those time na medyo wild yung sexual activity nyo, bawal po si IUD. Okay. Next example to is pills. So, pills po. So, it is when you're going to drink now your estrogen. As you have seen, it has an arrow. Oh, ito po, ito. So, remember, you have to drink the pills by following the arrow. Bakit po? While nag-advance po yung si arrow, nag-advance po, mas dumadami yung estrogenic level po nito. Thus now making your pregnancy impossible. Okay. So, hindi pwedeng paganyan ha. Dapat follow the arrow. Okay. So, and of course, you have to include now the iron or the brown one in taking because it will going to make you healthy. And then we have also your bawal po siya yung pills na makalimutan mo ikalawang beses. Pag unang beses nakalimutan mo, pwede mong i-take double by following the arrow the next day. But let's say, dalawang beses mo siya nakalimutan, so, Diyos ko, hindi na tayo makakasiguro na hindi ka po mabubuntis kasi na per day dapat mag-advance yung estrogenic level. Okay, tumadami yung estrogenic level. So, meaning, dalawang beses mo na siyang kung saan na pa, nalabnaw ba? Labnaw yung tubig. So, meaning, hindi na siya ng pregnancy. Makaka-block ng pregnancy. So, better check your doctor. And of course, this is your female condom or your cervical cap. Okay, so here, as you can see, this is a barrier method. The cervical cap fits snugly over the cervix, preventing sperms, from entering the uterus. So here, kina-cover po niya. This is now your vaginal canal here. And the tip of it, we have the cervix. Pinapush po yung cap, it looks like this. Okay, so it of course, it will going to block pregnancy. But sometimes, you could consider that yung having it is a little bit messy because it will be inserted by your husband. Okay, next, this is your example of your bilateral tubal ligation, ha? Nilagay po siya dalawa. Okay, here. So here. This is the example, not bilateral tubal ligation. It is an example of your vasectomy. Yung vas deferens nyo po ay cannot or deny po siya. Okay, that's it. And number 4 is rhythm. Those are anong number 3, we have your vasectomy. So, cannot po yung vastus deferens in males. Number 4 is rhythm method. Or this is now your calendar method. As what I've said, you have to observe your last menstrual period in here. So that hindi mo po mamimiss. Baka mabutis ka po. Tapos this time, the baby is unwanted kasi hindi ka gustong ayaw manganak. Rhythm could be effective if you're going to have it in combination with the cervical mucus and basal body temperature. Your cervical mucus, if the secretion of the woman, the white one or your white blood, will be lightly sticky. It is very much sticky, but it will going to stretch up to an inch, and it looks like a water in consistency. And then, of course, it will be now your what do you call this one? White blood. If that is your white blood, so you have to consider that you are not safe. Not safe ka po. Walang sexual intercourse. Kaya it will be stretched up to an inch man siya. Parang sip-on. But if the white blood is thick, thin man to siya and stretchy. But if the white blood of yours become thick and copious, meaning it is an anti-spermicidal agent. So it blocks now the what they call this one, not block the entrance, but it will going to it has a spermicidal agent, meaning it will going to kill now the sperm and making it unable to enter inside your cervix. So, diba? Because of that cervical mucus. Pag anong cervical mucus? Thick and copious. Parang paste po siya na medyo nakatagalan na po sa bag. And the next is your coitus interruptus. This is considered as your withdrawal. Diba? Kawawa naman mga babae nito pag mag-withdrawal. And next, we have contraceptive implants. Diba? Merong implants or your Norplant. So we have many 6 months to a year protection. And of course, you have spermicidal agents. This looks like azure jelly. This is also messy. Why? Before your sexual intercourse, you're going to place a jelly spermicidal agent on your vaginal area. And it is quite distracting to your male partner. And the sterilization, your BTL, and your vasectomy. So, BTL, what part? You have your isthmus po ang ikakat or itatay. Your vasectomy, your vas deferens now will be tied or cut. Tied pag may plano ka pa maanak. In the future, pag cut, wala na pong pag-asa. Okay, the next, male condom. So, male condom is 99% effective, of course. And you're going to wear condom once the penis is big. And of course, we have basal body temperature, cervical mucus. And number 12 is progesterone acetate or DMPA injection. There is your 3 months protection. Pero may disadvantage po nito, tataba ka po. Okay. Hormones produced, we have your estrogen and your progesterone, plus HCG and your HCS or HPL. So estrogen is the hormone for women, while your progesterone is the hormone for mothers. Remember, during menstruation, your estrogenic level should be high to prevent you from menstruation. And 2, of course, your progesterone is maintained low. If that's the case, you will not become pregnant. But if the progesterone is high and your estrogen is low, of course, there are lots of chances that you will become pregnant. While your HCG is human gonadotropin, indicates pregnancy. That's it. And then we have human chorionic somatotropin. We have promotes the growth of the mammary gland. Okay, Okay, from the word soma. Okay. And human placental lactogen also. So we have, if ever there is now your union, we will also have the syncytial layer, or the one that is produced after your fertilization, and of course your union of your sperm cells and egg. So there is now what we call as your pregnancy. So parts of your pregnancy, we have your amnion. So amnion contains your umbilical cord here and the amniotic fluid. So 52 to 55 in length, and then the amniotic fluid is a clear albuminous fluid that covers the baby, and it keeps the baby warm. So this is considered as the bag of water. This is the water in the bag. So this is your amniotic fluid. Functions of your amniotic fluids: it shields the fetus against pressure or blows to the mother's abdomen. Okay? And protect the fetus from sudden change in temperature. So hindi po totoo na pag ang bata po ay pag na-injured from mother, the baby will suffer from cleft lip or cleft palate. Remember, your baby is shielded by its amniotic fluid. Okay. And if it's shielded by your amniotic fluid, of course, hindi po siya ma-hurt, di ba? Hindi siya pwedeng ma-hurt kasi nga, may shield po siya. And protects the fetus from sudden change in temperature. Yes, of course. So, this to the amniotic fluid, it will going to protect the baby from sudden change of temperature. And protects the fetus from infection. Yes, that's it. Another thing is that the goal in having the baby is you always keep the baby warm. Okay, the next one is your coion gives rise to the placenta. Anyway, what way you have to measure now your expected date of confinement. So expected date of confinement is measured as your LMP, or last menstrual period, minus 3 plus 7. Okay, and that would be your wedding day. Well, if you're going to have a month of January, from January to March, so the formula is not minus 3 plus 7, but plus 9 plus 7. So try to compute, let's say February 20, 2022, kailan po siya mahanap? So kasi February, hindi po siya minus 3 plus 7, kundi plus 9 plus 7. So 9 plus 3, that is 01, January, and then let's say 20 plus 17 kasi February 17, so that would be plus 9 plus 7 plus 7 is 23 plus 7 is 30. So your expected date of confinement is January 30, 2023. Okay. So stages of human development, we have 12 to 24 hours, it is your zygote, 15 days to 8 weeks, that is your embryo, and 8 weeks to birth, that is now your fetus. So here is a picture of your uterus with your urinary bladder and your rectum. So this is now your uterus, here the blackened part. So this is now your bladder. As you can see, during first trimester, the woman has this tendency to always urinate. Why? Or feel like urinating? Because the bladder relies on your uterus. Diba? Tingnan nyo, nakaano siya. Pero sa mga retroverted ka naman na the mother or retroverted uterus ang meron kayo, so meaning, eto kung nakaganon siya, so retroverted na kaganon. So yung pressure niya nandun sa rectum. And this time, palagi mo mag-feel na tumatay ka kahit wala. That it happens to me. So that is your retroverted. Okay, retroverted. So this is now the picture of the placenta and then umbilical cord during pregnancy. Okay, and of course, that is your after pregnancy, the uterus, the baby is already removed, the uterus is still big. So, lying down with your urinary bladder here. So, this is your uterus. remember that the uterus will going to, after delivery, the uterus will going to decrease its size up to 1 centimeter a day. Up to 1 centimeter a day. So, you have to expect that after delivery of the baby, you still have this big abdomen because it will only decrease its size up to 1 centimeter a day. Anyways, as what I've said, to compute the EDC, or expected date of confinement, you have to record, I forgot kasi if I mentioned this, LMP, date of last menstrual period, minus 3 plus 7, if it is April to December, but if it is January to March, you have to compute EDC with the formula LMP plus 9 plus 7. Okay, now let's start with the factors affecting growth of the fetus. So these are termed as your teratogens. So the factors that affects the growth of the fetus is teratogens. One of it is maternal infection. So maternal infection, these are infections acquired by mothers while being pregnant, most especially during the first trimester or the first 3 months of pregnancy. So examples of infections, we have your German measles, or in Bisaya, this is your dalap. Dalap siya. Yung mga may puntik-puntik yung buong katawan mo, that is your dalap. It is more infectious compared to your tip dust or your normal measles or your rubella, rubella measles. Okay, it is said that if the mother is exposed to it while being pregnant, if the woman pala, if this is exposed to it while being pregnant, it will affect the vital organs of the baby. You could possibly have a brain without a skull, or let's say, or a brain which is very much visible, kasi very thin yung covering niya, your scalp niya, very thin. Pwede ding you will have amelia. What do you mean by amelia? Absence of limb, nasilang bata, wala po siyang kamay, walang paa. That is also brought about by your teratogens. Maternal infections. Not only maternal infection, but all just say, for example, your drugs, okay, prohibited drugs in particular. You may observe now the baby suffering from having a mother that is being having abuse with drugs. So possibly they are, if there is no problems with their vital organs and all, maybe their brain activity is affected. They will be slow learner, or autism, or ADHD, or attention deficit hyperactivity disorders, and all. Diba? So you have to limit yourself to, not limit, but you have to prevent yourself from drinking or having prohibited drugs. Okay. And of course, if remember that during pregnancy, women are not allowed to take any drugs, especially without doctor's order, because remember, in every pill there's a kill. So make sure you have to prevent that from occurring, since you have a growing fetus inside your womb. Number 3, we have environmental teratogens. This involves we have living conditions of the patients, and of course, it could also affect radiation. So radiation, especially if the pregnant woman is exposed to radiation, we have the bitang X-rays, diba? They should not go to the X-ray room. That is why in the X-ray room, there's a big X mark there with a woman who happens to be pregnant. And that is also why that the women during eclipse and all, they're advised to wear black panties, black saya, and all, to protect their baby from the radiation. Another thing is pica, P-I-C-A. Pica means unusual craving of food. So this could also affect the growing fetus. That is according to some, as claim. Sabi kasi, pag hindi mo binigyan ng certain pagkain na gusto ng babae buntis, something will happen to the baby, di ba? But remember, those things rarely happen. Sometimes man God, having those words, na pag hindi mo ako binigyan ng mangga ng kapitbahay natin, mawawala si baby. O, sabihin na, pag hindi mo ako ninakawan ng mangga from the mango tree of our kapitbahay, the baby will be gone. Remember, so, kailangan talaga nakawin, di ba? No? Diyos ko naman, remember that discipline always starts even at the womb. Even if the baby is still in the womb, di ba? So, make sure you should not go with those. So, that is also your stress, ha? That is under your stress, I mean, your PICA. And there's also women who suffered from stress because of their alcoholic husband. Possibly the baby has having problems with breathing when they go out, or having what they call as your congenital heart defect. With this, maternal infection, drugs, environmental stress, environmental teratogens, and of course your stress. Now, we're going to proceed with the 3 P's of labor. Ayaw niya. Bakit? Okay, next slide, please. Ayaw talaga. What's wrong with this? Just wait. We're going to proceed with your labor. So, labor is physiologic mechanism by which the product of conception is expelled outside the mother's womb. So, lalabas na po yung baby. We have 3 P's of labor. Your passenger, which is the fetus, the passage, which is the pelvis of the mother, and of course, the power, we have uterine contraction. Dapat present po yung tatlo, tapos dapat din, ano ba yan? Yung bang dapat walang problema between in age. Example, yung passenger, dapat po siya tama-tama lang po yung size, 7 pounds pag Pinoy, di ba? And then we have also passage, yung pelvic ng mother. Dapat yung pelvis ng mother, malaki yung pelvic inlet para ready po lalabas yung baby. Yung malaking balakang hindi po siya guaranteed na malaki yung pelvic inlet niya po. Pero, may possibility. In my case, malaki yung balakang ko, pero hindi malaki yung pelvic inlet ko. Tapos yung baby ko naman, malaki, so hindi siya lumalabas kasi nga, maliit lang po yung sipit o yung pelvic inlet. Kaya it leads to cesarean section. And of course, yung power, yung uterine contraction, yung umiiri ka na pero hindi naman lumalabas si baby kasi yung area is hanggang sa leeg lang po. So definitely, there will be problems. You will end up still with your either induced, or we have your forceps delivery, or we have also your cesarean. Now we are at fetal presentation. So, pag lumabas po yung baby galing sa womb ng mother via your vagina, so that is now your normal spontaneous vaginal delivery, NSVD po. Lalabas po siya either cephalic, which means ang head po ang lumabas, head part ang nauna, ito po. And then we have, it's either occiput, so meaning ito sa back ng head po yung nauna, there's your occiput cephalic. And then curve, face po yung naunang lumabas talaga dun sa puwerta ng babae, and or your chin, ito po man yung nauna. And then number 2, we have your bridge presentation. So this is your footling, isang paa lang po ang lumabas. Pag ganito, dapat isoli niyo po yung paa at hanapin niyo yung isa. You got the other one and making now the bridge presentation complete. Well, the other is letter B. We have your flank, which means yung sacral area po yung nauna. And number 3, this is shoulder or transverse. It is hard to deliver, so it will really result to cesarean section. So, cesarean po tayo pa, shoulder. Ito yung mga curse ng mother. Sabi na, example, sinabihan yung, kailangan muna ako ng unan ha. Sinabihan yung anak niya, nabuntis na, pag nanganak ka, dahil retubada ka, sana, pag nanganak ka, it would be babag or transverse, diba? Transverse po. O, diba? So, you are cursing your daughter or pregnant daughter. Okay. And next natin is your postpartum. So, let's say, nanganak na po yung mother, ha? Tapos ay yung women. So, you're going to, dahil nanganak na po siya, let's say cephalic presentation, so you're going to deliver now the baby and immediately place the baby in, on top of the mother's abdomen. That is also to encourage the uterus or they encourage delivery of the placenta. The placenta is the connection of the mother and the baby. Remember that. So during that time, anyway, so we're going to discuss that time in the care of the newborns. But brief lang po. So during that time, pag-deliver na ni baby, you have to make the baby cry, which we will be discussing on the newborn care. And then after that, cut na the umbilical cord. And then, of course, continue the placental delivery. Okay. So after the delivery, the mother will have this postpartum. So post meaning after, partum meaning pregnancy. Postpartum, this is termed as your puerperium. Puerperium, this is the 6-week period after the child's birth, considered as the 4th trimester of pregnancy. So, puerperium po ang tawag doon sa 4th trimester ng pregnancy. So, we have maternal changes that takes place. We have retrogressive. Retro means pabalik ng nakaraan. So, retrogressive. This is now your term as your involution. Example, the vagina will going to return to its original shape or non-pregnant state, but definitely it will not return to its original shape. Not original. And then progressive, since there is no production of milk beforehand while you are still pregnant or while you are not pregnant, but this time you have a production of milk. Okay. Another is for the 9-month period, you're not having your menstruation, but this time, you will have the menstrual flow na. Okay, that is why it is called progressive. Okay. So, psychological changes occurs. We have phases of puerperium, the taking in, taking hold, and letting go. When we say taking in, this time the mother is totally dependent to his or to her husband, tubig, pagkain, and all, samahan mo ako sa CR, and all. While you're taking hold, this time the mother is already doing or performing light hold chores. So, you're taking hold. So, medyo gumagawa na po siya ng mga gawaing bahay, nagluluto na po siya, pakonti-konti lang, ganon. And when you're letting go, it is when the mother already functions here as a normal housewife. Balik chimay na naman si mother. Not necessarily na balik chimay. So, a normal housewife, niluluto, naglalaban, all. Number 2 is this is the rooming in. So, meaning, it is executive number, I forgot, maybe, I don't know if I'm correct, it's number 51, when the mother, when the baby will be placed automatically at the bedside of the mother, right after delivery. Hindi na siya pwedeng ilagay sa NICU or sa ano ba yan? NICU nga, o Newborn Intensive Care Unit, o dahil siya NICU. And of course, we have postpartum blues as a psychological changes. This is an overwhelming sadness experienced by the mother days after the delivery of the baby. So have you tried to become a mother na parang naiiyak ka na walang reason? Kasi na pag on the sight of your child, the sight of it makes you cry. Maybe you cannot believe that the child is yours, is coming from you, di ba? Or maybe sometimes you have you cannot believe that pangit yung anak mo tapos maganda ka. Diyos ko naman. Or parang ang ganda-ganda ng anak mo tapos ikaw pangit ka, vice versa. So ganon. So there's your postpartum blues. Or maybe because you don't have the support of the husband, since the husband is not around, or the father of the child is not around, or maybe the pregnancy wasn't that wanted. Okay. There's your postpartum blues. Remember that if postpartum blues will not be handled properly, it will result to postpartum depression. And if it is going to result to postpartum depression for several days, weeks, and even months, it will now result to postpartum psychosis. Psychosis meaning mabuang ang pasyente, ang women, ang mother di ay nga nag-give birth. This is because parang ang poor support system from the father or from the child, from the family members, diba? Kasi busy silang lahat. And sometimes, especially if you are expecting of something and yet it doesn't happen, so that's the time you will have also your postpartum depression, or to the extent you will have postpartum psychosis. Now we have physiological changes that occurs, as what I've said, is the involution. The uterus is within 24 hours after the delivery of the baby. It will be in the level of the umbilicus, and it will decrease 1 centimeter a day. So, medyo malaki pa yung tiyan niyo po after delivery. Kasi 1 centimeter a day lang po, di ba? So, have you experienced ang katatapos mo ng mga anak po, sinabihan ka ng kakilala mo, uy, buntis ka? Kasi nga, malaki pa yung tiyan mo. Number 2 is the cervix. It closes but won't return to its original shape. Normally, this is the size of the cervix. Ito, saan ba yung camera? Ito. Yan. Ito. Itong round na to. Itong round na to yung cervix. Parang ganyan. Oh, that is the normal. But pag naganak ka na, parang naging star-like na po siya. Hindi siya magre-return to its original shape. Next, the vagina. Labia appears flabby because of the loss of fat that serves as the cushion. So, remember, flabby, so medyo namuruyot ang vagina. Okay. Because of the loss of fat after the delivery. So, of course, it will return to its non-pregnant state, but of course, it will not return to its original shape. And number 4 is the perineum. The perineal area. So, perineal area, so I've said na right after the delivery of the baby, while delivering the baby, you have to support the perineum of the mother, or it is the space between the vaginal opening and then the anus. Bakit po? Kasi pag hindi mo po siya sinuport, automatic it will going to tear up. So, automatic there will be laceration, di ba? And sometimes the tearing of it will be straight directly to your anus. So, may tendency, may chance ka po na tumais sa vaginal area niyo po. Kaya dapat po siya automatic during periods of contraction, especially if you feel that the baby will be there after, you have to cut it with you laterally using a bandage scissor. So, meaning, medial is straight from the anus and then lateral or side. So, that's your medial lateral. And the term of the cut is your episiotomy. And after which, you're going to have episorrhaphy. Raphy means repair. So, they will undergo this, what we call as vaginal repair. Okay. But how about those people who just deliver the baby at home? Of course, they are not repaired. Diba? their vagina are not repaired. Vaginas are not repaired. So definitely they have this what they call as problems or this uncomfortable situations of their vaginal area. Okay, so remember during prepubertal stage, this is the stage of your lochia. So lochia, uterine discharges that escape vaginally during preperium. At this time, parang automatic after delivery, dinudugo ka po or may dugo ka na po lalabas. So these are termed as your lochia. The lochia are possible, the contours of it, we have blood of course, mucus plugs, mga labit-labit, plus decidual particles, diba? Yung mga parang mga ugat-ugat na lumalabas, plus WBC or white blood cells and your RBC or your, but then of course there is presence of bacteria there in your lochia. And pero, di naman po siya offensive. Remember, the lochia is non-offensive, non-offensive siya. Types of lochia we have, has this pattern. Pattern is lochia rubra, serosa, and lochia alba. So lochia rubra, red in color, moderate in amount, and appears first 2 to 3 days after delivery. While your lochia serosa, brownish to pinkish and scanty in amount, and appears 4 to 10 days after delivery. And the last one is lochia alba, whitish to yellowish, and present 10 to 14 days after delivery. Again, it should have a pattern. So we have moderate and then scanty and of course wala na po. So there's your lochia rubra, serosa, and then alba. Guidelines assessing lochia. So how would you know if the lochia or the discharge that coming out from the mother has a problem? So we have the amount. When it comes to the amount of the lochial discharge is similar to the amount of the menstrual flow. And that is 250 ml. While your consistency, there should be no presence of large clots of blood in your lochia. Okay. And then we have also the pattern. It should follow lochia, rubra, serosa, and then alba. And remember odor. The lochias don't have any odor. Remember that. The odor of it is similar to your menstrual flow and could be identified as what they call as your blood, diba? Absence of lochia, it also signifies placental retention. That is why there should be no absent of your lochia. Okay, do you follow? Okay, next to that, we have postpartum care. How? So dapat kasi your mother should be cared for, diba? How would you do it? We have your promote sleep, adequate sleep by, saan siya? Promoting a quiet environment to allow frequent rest period. So how would you do it? Minimize interruption. Paano minimize interruption? So you have to disallow those people who are going to do some chit-chat or hang out with inside the house of the pregnant of the mother or the mother who just delivered her baby. So minimize interruption. Pag tulog ang baby, automatic dapat matulog ang mother para hindi po siya ma-disturb. Kasi especially during the first 2 weeks of pregnancy, first 2 weeks when you are about to deliver, your mother, let me ask about this, how to minimize interruptions. So you have to, what we call this one, schedule visits, okay? Okay, then do not ask ask the neighbors to visit you in the morning because those are the time that you could still have this need to rest, okay? And then we have perineal care. How? Assist the woman to carry out perineal care, warm water over the perineum after each voiding and or bowel movement and routinely several times a day to promote comfort, cleanliness, and your healing. And then next teach the woman to contract her buttocks, sitting to display your discomfort while sitting in a chair. So those are mga basic things that you have to remember. And then voiding, pag-ihi. Assist woman to void every several hours to keep her bladder empty. This may help reduce uterine cramping and promote comfort. Remember those, with our discussion? And then we have your breast care. How? Teach women to wash breast with warm water and there should be no soap. Bakit? Kasi mariremove po protective skin oil, especially in the nipple area. Assist breast and nipple condition for reddening, erosions, and fissures. Report to your supervisor for any signs of inflammation. Teach the mother to air dry the breast 15 minutes several times a day. So it doesn't mean that you're going to go out in your house and I'm telling you, wear no bra at all. So it should be, you should not wear that brassiere for a longer period of time, but have a break for your 15 minutes several times a day in every time convenient per day. Instruct the mother to wear brassiere or breast binder to provide good support night and day. So dapat lang po. Check the breast for signs of engorgement, swollen, tender, tense, shiny breast tissue. Allow warm to hot water to flow over the breast to improve comfort. And the next is instruct to express via some milk manually or your by breast pump to improve comfort. And the last one is nurse the infant. Okay, kasi yung nagpa-check ako sa breast ko dun sa 10,000 yung payment. Diba? So it's a bit expensive. So we have your breast self-exam which we will be doing in your written demonstration oral. So you have this one, the procedure. First, what will you do? You have to do it 5 to 7 days after your menstruation, So one is breast self-care. First is you have to stand in front of the mirror and then where you can see yourself from your waist up. So make sure if you could see yourself from waist up, you should have a good lighting condition. And then observe your breast from the front and then from right to left. Okay, so front ka po, tapos gigil ka from side to side ka naman, right to left. And after that, you have to note for any abnormalities of the breast. And then next is with arms at your side, notice the normal size, shape, and color, contour, veins, nipples, and other characteristic of your breast. Okay, dapat ito lang dapat hindi po sila equal in size. Yung isa medyo maliit. And then raise your arms to above the head. Both breasts should rise when the arms are lifted. So i-raise po niyo yung kamay niyo po ganyan and then dapat i-feel niyo po na mag-raise po yung breast when your arms are lifted. Okay. And then after that, you bring your hand in front of you at shoulder height, press then each other's palm. Then contract the chest wall muscles. Your breast move during position changes. Okay. And then you put in your hands on your hips, squeeze your shoulder inward, paganyan, paganyan. And after that, inward. And then after that, and lean slightly forward and down. Look to see the breast appears normal for you. And then the last one is you have to lie down with one hand under your head and you have also under the scapula. On the side you will examining. So dapat may towel po na ilagay sa scapula. Okay, and then bring your middle 3 fingers at the other hand together and using the flat part of the fingers. Move in small concentric circles. It usually takes 3 circles to cover the entire breast and you must include your tail. Upper cake, areola, check for discharge just move the nipples from side to side mobility. Then we have repeat of the other breast. Repeat this technique during bath or shower, and then when soap and waters will be allow you. Figure, natok na ako eh. Then after those, ito po yung picture ha. Okay. So, yan. Diba ang ganda? Ang ganda ng scene. O, dapat may towel under. Yan. And then night and elimination, how? Emphasize food high in iron, protein, and vitamins to aid in healing process. Foods such as fresh fruits and vegetables with high fiber to establish normal bowel habits. Remember those, ha? And if breastfeeding, instruct women to take additional calories and vitamins. And promoting frequent ambulations, ensuring adequate fluid intake, encourage regular bowel elimination. Remember those, ha? Exercise, we have aimed at regaining muscle tone and body shape, promoting comfort. So, mostly yung mga mother ngayon hindi na nag-exercise. Seldom na naman kita bebe. Next, we have postpartum exercises. This is your toe stretch. It tightens calf muscle, magkinto-kinto ka. Pelvic floor exercise tightens perineal muscle. Bicycle tightens your stomach and waist. Or buttocks exercise tightens your buttocks for twist. We have tightens waist. So resumption of sex. So remember, intercourse may be resumed when perineal and uterine wounds have healed already. Consult your supervisor or physician if possible. Normal healing occurs 2 to 4 weeks. Let your client consult physician for your stage of contraception if pregnancy is to be avoided. Okay, now we're at your newborn or neonate. So your newborn or neonate, actually this is under your infancy, ha? But since this is a very much crucial stage from the word newborn, meaning new, bagong bata po. So, newborn. So we have, it have a special age bracket kasi crucial na stage po to. Pag hindi mo po ginawa yung breast mo dito, pwedeng there's something that will happen to the baby. One is, this is 0 to 28 days old. So one is immediate care, one is maintain patent airway. So maintain patent airway by T position. So T position meaning T po, parang ganyan. So right after delivery, you are going to bring the baby up. So ulo po una. And then after that, turn the baby upside down, ganyan na. And para, of course, then you have to tap the puwetan the baby and or make the baby cry para malaman mo kung ang baby ay may breathing po. Dapat umiyak po siya. And then after that, after iyak, so you have to bring now the baby to the table and do some suctioning. I-suction niyo po yung mga secretions na nakita niyo po. You have to start suctioning from nose first before the mouth. Kasi yung respiratory system mo, dapat i-maintain po siya na clean and sterile. Okay, that is your nose and then mouth. Okay, after that, you do your skincare through bathing. Have bathing po. Then, after that, you have to do your cord dressing. Antiseptically, you have to note presence of 2 arteries and 1 vein. So, makita mo po doon, when you're going to, as in the cutting area, may 3 dot po doon ng blood. So, that represents your 2 arteries and 1 vein. Plus, we have vitamin K injection for 0.1 cc intramuscularly. This is to promote blood clotting sa baby. Okay, kasi wala pa sila dito. And number 5, you have your Prophylaxis, that is to prevent neonatal blindness. Meaning, you have to befriend with your you have to place an ointment, diba, antibacterial ointment on the eyes of the baby to prevent neonatal blindness. Kasi po, neonatal blindness is acquired specifically after the baby will acquire it after passing the vaginal area. But since we don't know if the woman has STD or not, the current prophylaxis is applied to all babies. So, dapat apply to all babies po siya. Saan na tayo na to? So, post muna tayo, ha? These vital statistics. So, the weight of the babies is we have 2,900 to 4,100 grams. Excuse. And then average in males, we have 3,400. And in female, we have your 3,200 grams. Height is 46 to 56 centimeters. And the head circumference is 33 to 55 centimeters. Chest circumference, we have 31 to 33 centimeters. Abdominal circumference, 31 to 33. As you can see, 33 po yung 35 po yung pinakamalaki. Yung head circumference po is 35. So, pag more than 35, so you have to adjust it accordingly because this is a sign of what they call as your hydrocephalus. Hydrocephalus po yun, ha, pag more than 35. And then next is we have your more than 35. That is why you have to manage it. How? You make sure you have to use centimeters as the unit of measurement to be accurate and exact. Another, you have to measure the head size same time each day para accurate din po. And then yung measure din po, it should be from occiput here, the back of the head, to your frontal and go back to the occiput. Hindi pwedeng parang minuduha dito, so tapos ganyan, hindi pwede. Okay. And then we have your chest circumference, so possibly the congenital heart defect of more than 33. And the abdominal circumference possibly this is the signs pag mataas or malaki po, so possibly you have your obstruction there, or possibly you have your liver problems and all. Number 7, we have vital signs. The temperature 37.3 and normal we have 37.5 degrees Celsius up after expulsion. Meaning paglabas ng baby from the abdomen of the mother. And the pulse is 120 to 160 beats per minute, especially 160 beats per minute pag kalalabas lang po ng baby from the womb. And respiration, we have 35 to 50 breaths per minute. Okay, yan po yung normal values, ha? Okay, yan po yung mga normal values. Okay, next is we have how will you promote bonding sa mother and child? One is bakit ba yung gamit ko? One is show the mother to the baby to the mother. That is, and then you have to show it so that it will you have to promote bonding. And latch on, meaning the mother should breastfeed the baby. Okay. Initiation in breastfeeding is 5 minutes for each breast. Initiation meaning umpisa po mag-breastfeed. And verbalize similarities of the baby and the mother to promote bonding. Sabihin mo, magkamukha kayo. Pag tatlong butas ng ilong nyo, hollow block ang datingan. O datingan, di ba? So, may makakapal ang mga labi nyo, ma'am. Kapwa kayong matkapal ng labi. Manang-mana po sa yung anak nyo, something like that. Then, breastfeeding should be 10 minutes for each breast, which total 20 minutes. There's 10 minutes for nourishment, and then 10 minutes for sucking pleasure. Okay. So, figure sterilizing bottles, ha, yan po. I'm going to demonstrate that this is in ordinary pot. As you can see, the bottle is standing. Tapos may lalagyan po siya sa loob para hindi siya matumba. Another thing, may laman po yung bottle. Yung laman niya po ay tubig. So, especially kung ordinary pot, dapat stand po siya para tapos may laman ng tubig para pag mag-boil po yung tubig sa loob, meaning sterilizing now is done, ha? So, dapat may laman. And you're going to sterilize the bottle for you have to sterilize for 15 to 20 minutes after boiling point. May indication po doon, after boiling point. So, meaning, nag-boil na po yung bottle. 20 to 30 minutes pala after boiling point. And then remove the bottle, the nipple ring and the nipples for the first 5 minutes para to prevent it from melting or destroying the nipples. So this is how to bath the infant. So first is over your shoulder with the head facing at the side. Second is again, first, over your shoulder with head facing at the side. Second is sitting position, okay, here, and apply light pressure on the back. And the next is across the lap, or pinapahiga niyo po sa lap, tapos one leg is elevated than the other. So you have to pat the back. And you also have abdomen to abdomen, and next is football hold. Okay, that is way, especially if the father will be feeding the baby. So, feeding the infant with solid food, you have to wash your hands, obtain correct food and spoon, yes, and check infant's identification if there is. Passive position the infant and put bib on the infant. The bib protects the infant from spillage of milk or your food during feeding. Okay, and also you have to put a bib. Check the temperature of the food. Then you have give small bites, refeed as needed, wash infants as needed, diaper if necessary, wash your hands, check infant as for comfort and safety, and the last one is whether the mouth will take it and kind of food if necessary. Okay. Diba? We have physiologic changes in newborn. One is after her delivery, weight loss. During the 7 to 10 days of life, there will be 5 to 10% of body weight, diba? So, weight loss ka ng 5 to 10%. Then after 10 days of life, it will going to gain a pound. So magigain po yung baby. And 6 months, the baby will going to double its birth weight, and in 1 year old, the baby will going to triple its birth weight. Number 2, this is number 2, how this will jaundice. Body will become yellow due to immaturity of the liver, common beginning on day 2, peaking at 1 week, and disappearing a second week. So, this is yellow coloration of the baby because of your immaturity of the liver. One is when you expose the baby to early morning sunlight. They say vitamin D. Actually, your skin has the ability to convert itself to vitamin D, huh? Number 3, 2 to 4 days of life. Some babies will experience from fever. This is associated with dehydration and loss of weight. Remember, we have physiologic 5 to 10%. Okay. Physical assessment, the newborn. We have posture, full-time newborns assume symmetric posture, face turned to the side, flexed extremities, hands tightly fisted, and palm covered with fingers. Parang ganyan. Okay, yan. Yan po yung kamay ng baby, ha? Palm is covered with fingers. Another we have your hands tightly twisted and your face turned to the side. Infant born in this position may keep knees and legs straightened on or in front position depending on the type of breech presentation. While your length and weight, you have to take note in what we discussed a while ago. Okay. Now we have skin of the baby. Skin marks. One is hair distribution. That's your lanugo. Lanugo is fine down in hair present in baby's skin. Now, tignan parang bulbous yung baby. That's your lanugo. And then next, we have turgor of the skin. Good, the baby is having this good skin turgor. Then sometimes the baby suffers from cyanosis, as we have here in this one picture of nag-blue yung hand. Yan. Cyanosis, yung hand nag-blue. This is due to immaturity of the liver, common the top part of the body, particularly the extremities, because of immature peripheral circulation. Okay, and then next we have pallor, indicative of cold stress, anemia, or cardiac failure. So, that is your pallor. Maluspad siya. Level 6, plethora, reddish coloration may be due to excessive red blood cells from intrauterine, intravascular transfusion, such as result fluids, cardiac disease, and diabetic mother. So, that's your plethora, ha? Ayan ang picture, red po yung color ng baby. And we call him staining. We have stain in the skin and fingernails. So, this is greenish discoloration of the skin. Okay. Which are, we call him staining. So, ito po yung picture, ha? Yung newborn skin marks, your lanugo, balbon po siya. Yung circle, you take note the circle, yan. Kita nyo, may balbon yung baby. And then next, we vernix caseosa, whitish cheesy odorless substance that covers the baby. So we have your vernix caseosa. Another we have milia. So as you can see, itong siya may circle. What pinpoint particles that can be found in the nose and the skin and even the cheek of the baby. And then we have also your Mongolian spot. This is grayish, blue spot at the lower back due to accumulation of pigmented cell melanocytes. Yan po, that's your Mongolian spot. By gray po, may bluish color po yan. Okay. And then, next, desquamation. As you can see, mag-peel off from baby. That is your dry peeling of the skin of the baby. Usually, ang desquamation baby goodness. Desquamation is noted pag especially when the vernix caseosa is properly clean, so usually mag-desquamate yung baby. And then next, you have stork bites. Yan. Ito po may yellow na circle, ha. Yan. Red spots fall at the back of the neck and above the eyelids of the baby. That is your stork bites. And next we have erythema toxicum minatorum or newborn rash. Ito po yung hindi kasi naliligo yung baby nito. Dapat everyday ang naligo, ha, to prevent erythema toxicum minatorum or newborn rash. Ha, yan yung picture, ha, newborn rash. And the next newborn feeding reflex test. One is whooping reflex. This is when you're going to place your finger on the cheek of the baby will then automatically step towards the finger and then lead his mouth to it, and then you have your suck. Okay, there is your feeding reflex, whooping. It disappears 7 months of later disappearance, 3 to 4 months after disappear po yun. And the number 2 is sucking reflex. Anything that is placed in the lips, it will be automatically sucked. Okay. And then the opposite of that is extrusion reflex, the spitting up reflex. Diba? Number 4, swallowing extrusion. Anything you're going to place at the tip of the tongue of the baby, it will be extruded. Extrude po. Pero pag bottom part, it will be swallowed. Number 4 is swallowing reflex. Anything that touches the position of the posterior portion of the tongue should automatically be swallowed. So those are your feeding reflex. The rooting, the sucking, exhaustion, and your swallowing. Next to that is protective reflex. The sneezing, yawning, and blinking reflex. So your sneezing is clear the air passages, that is your sneezing and coughing, which is the beneficial, yes. Yawning, it protects also the cell from depleted oxygen supply. Meaning, wala ka na pong oxygen pag may lagi ka nag-yawn. And blinking protects the eyes from the object that comes near. Okay. Numbers, letter C, molar startle reflex, embracing motion of the arms in response to loud noise or jarring of the crib. Okay, that's your molar or startle reflex. Tonic neck reflex or fencing. When neck is turned to one side and arms and legs are at the side extended and opposite arms and legs will be flexed. Okay, remember how the Babinski, funny or hyperextension of tongues when the soul is strong from heel upward. Yan po. Ito yung soul. Pag ginanyan mo, yeah, so you have, ano yan, you're going to push your hand to manipulate the soul away. Letter F, this is your Darwinian or dancing reflex. Feel quick alternating steps when newborn is held upright and feet touches the ground surface. So, hindi po siya masastumble agad pag binitiwan niyo po maglakad. So, it will just walk and then after that, it will going to stumble. So, there's your Darwinian or dancing reflex. Letter G, magnet reflex. If pressure is applied in the sole of the feet, when infant lies down in supine position, he pushes back against that pressure, manipulating his feet. So, same feet, yun po ang ginawa ng kinuha niyo po sa amin na Next is letter H, cross extension reflex. If one leg in the body is extended and the sole is irritated by rubbing with a sharp object, raise the other legs and extend and try to push away the objects. So, ito naman, yung paa niyo naman po magpupush ng object when you check. And this is the power glass reflex. So, ganyan, pag ganyan ka, so binabay mo yung kamay mo, automatically po-close siya. There's your palmar glass reflex. So, sleeping time of the newborn, you have your 20 hours per day. While your feeding pattern, most newborns eat 6 to 8 times per day or with 2 to 8 hours between feeding. So, regular feeding will be established in about 2 weeks. High calorie requirement 110 to 130 kilogram body weight. Then after that, of course, there's a tendency that the baby will going to regurgitate or regurgitate siya. Next is elimination. This is just the stool. It is past 24 hours to 48 hours at the show meconium. Transition, there is your 2 to 3 days. Milk stool, passed by 5. Pag sabi mo sa transition, bluish to yellowish yung color. Pag meconium po, pure green kasi. And in the sense test, we have the sight all newborns can see at birth through the elbow. They cannot see objects as part of their visual midlife. Number 8, letter the hearing. As soon as the amniotic fluid has been absorbed, yes, you will have a sense of hearing. And in the taste, as soon as the secretion have been suctioned. Okay? And in the smell, as soon as the nose has been free from mucus and fluids. And in touch, most develop of all parts and cells. So, closing the newborn, observe the rule of the thumb. If the mother feels warm, keep the baby cool. If the mother feels cold, keep the baby warm. So, this is a premature infant, born before 7 weeks of gestation. Characteristics, we have respiratory muscles are fully underdeveloped. Yes, this one, it looks like an 80. Dog and cough reflex are poor. Thus, aspiration may be a problem leading labor, bleeding, and irregular periods of apnea and your cyanosis. Check. Chest wall lack stability. Then po, pag may premature. Digestive system. Stomach is small. Vomiting is likely to occur because of the poor muscle tone. That is why it is hard to provide caloric requirement in earlier days. Lack of coordinated sucking reflex and swallowing reflex. Tolerate is decreased and related to decreased enzyme. Immature esophageal motility. O, yung baby po natin. Poor thermal stability. Okay. Low rate stabilization there with thin skin, poikilothermic, automatic poikilothermic, basically adapt the temperature of the environment. Limited ability to shiver, yes. Inability to respire, so decrease. Metabolic rate and heart production. Temperature should be taken by auxiliary reflector cause crying means an increase in energy expenditure. Physiologic, excuse, exaggerated weight loss. So yun po, pag may ganito, exaggerated weight loss, so suspected. General activities will be weak, assume a frog-like position, actually have less muscle tone. For the other concerns, response to stimulation is low. Active form of antibodies is lacking at birth, and you will be susceptible to MS disease, ability to receive visual stimulations, and you have depressed questions between dermis and epidermis. Clinical manifestation of a premature poor ear cartilage. Tapos sobra. Disproportionately large head. Yes. Skin is very thin and wrinkled face resembles an old man. And the testis is undescended. Okay. So, those are all about Pediatric 1. Thank you, and of course, don't forget to push the link button so that you will be notified. With the bell pala, so that you will be notified for my next video. And of course, do not forget to like and subscribe. This is Irene talking to you in English for the sake of your child care. Thank you very much, everyone.